What is autism spectrum disorder? Autism spectrum disorder is a neurodevelopmental disorder that begins early in childhood. It involves persistent challenges in social interaction, verbal and nonverbal communication, and restricted, repetitive patterns of behaviors and interests. Autism spectrum disorder includes conditions such as autism, Asperger's disorder, childhood disintegrative disorder, and pervasive developmental disorder. ASD is known as a spectrum disorder because the effects and severity of symptoms are different in each person. Through the years, there's been a marked increase in the prevalence of autism. Currently, 1 in 54 children have been identified with autism spectrum disorder. Boys are 4 times more likely to be diagnosed than girls. 44% of individuals with ASD have average intelligence, 25% have borderline intelligence, and 31% have intellectual disabilities. Autism spectrum disorder affects children of all races, social, ethnic, and economic backgrounds. The cause of ASD remains unknown. Ongoing research is being conducted in both genetic and environmental hypotheses. ASD is characterized by deficits in social interactions, speech and social communication, and restricted repetitive behaviors and interests. Individuals with ASD often have difficulty with social skills and social interactions. They are also less likely to engage in pretend play, appear unwilling to respond to friendly interactions, and appear unable to grasp the basics of symbolic play. Challenges with social skills and social interactions include avoiding eye contact, often preferring to play alone, avoiding personal contact, and having difficulty taking others' perspective. Individuals with autism have difficulty with spoken language, and about 1/3 are nonverbal. Challenges with communication include delays in spoken language, delays in speech, difficulty using appropriate tone of voice, difficulty understanding humor and sarcasm, and using echolalia or scripted language. Kids with autism often exhibit unusual interests and stereotypic behaviors, and are also less likely to engage in pretend play. Unusual interests and stereotypical behaviors include ritualistic behaviors, focusing on parts of objects, staring at lights, spinning objects, and may be caused by sensory sensitivities. Children and adults with ASD experience the world in a different way. Some may have sensory integration dysfunction, in which sensory input is not well organized in the brain. Sensory challenges may impact sights, sounds, touch, smells, body awareness, balance, and taste. Because children with autism experience sensory sensitivities and a variety of social communication deficits, they often exhibit behavioral, attentional, and emotional regulation challenges. In some cases, individuals on the spectrum have strong focus on activities that spark their interest. Some of these interests may potentially continue to adulthood. A study in 2015 found a strong link between autism and creative thinking. Many individuals with ASD are visual thinkers. Art naturally allows self-expression through images while also being a soothing activity. Individuals with autism may have other exceptional skills in creative arts, such as special talents in music, especially in pitch discrimination and memory. Early diagnosis and interventions for autism are more likely to have major long-term positive effects on symptoms and life skills. The American Academy of Pediatrics recommends screening for ASD at 18 to 24 months of age, as symptoms typically appear within the first 3 years of life, with diagnoses often occurring around age 2. Children who receive early intervention, such as speech and language therapy and occupational therapy, have improved outcome, increased success, and independence. Early and ongoing intervention not only gives children the best start possible, but also the best chance of developing to their full potential. Inclusion of children with autism can strengthen the fabric of our society. Remember, it takes a village to raise a child. It takes a child with autism to raise the consciousness of the village.
Thank you for watching our video. Please subscribe to our channel to stay updated on our latest content.